Tibial and Peroneal Arteries. In this video, you'll quickly learn about the anterior tibial, posterior tibial, and peroneal arteries, their origin, course, branches, and key points. Let's begin. This is the main artery of the anterior compartment of the leg. The blood supply to the anterior compartment of the leg is reinforced by the perforating branch of the peroneal artery. Origin. The anterior tibial artery is the smaller terminal branch of the popliteal artery. Course and relations. It begins on the back of the leg, at the lower border of the popliteus, opposite to the tibial tuberosity. It enters the anterior compartment of the leg by passing forwards close to the fibula. In the anterior compartment, it runs vertically downwards to a point midway between the two malleoli, where it changes its name to become the Dorsalis Pedis artery. Branches. Muscular branches supply adjacent muscles. Anastomosing branches are given to the knee and ankle. The anterior and posterior tibial recurrent branches take part in the anastomosis around the knee joint. The anterior medial malleolar and anterior lateral malleolar branches take part in the anastomosis around the ankle joint or malleolar networks. Posterior tibial artery. Origin. It is the larger of the two terminal branches of the popliteal artery, because its branches not only supply the posterior compartment, but also the lateral compartment of the leg and the sole of the foot. Course and relations. It begins at the lower border of popliteus, between the tibia and fibula, deep to the gastrocnemius, and enters the back of the leg by passing deep to the tendinous arch of the soleus. In the leg, it runs downward and slightly medially to reach the posterior or medial side of the ankle, midway between the medial malleolus and the medial tubercle of calcaneum. It terminates deep to the flexor retinaculum by dividing into a large lateral plantar artery and a small medial plantar artery. Throughout its course, it is accompanied by the tibial nerve, which crosses the artery from the medial to lateral side. Branches. Peroneal fibular artery. It is the largest and most important branch of the posterior tibial artery. It arises 2.5 centimeters distal to the inferior border of popliteus, muscular branches, to the muscles of the posterior compartment. Nutrient artery to tibia. It is the largest nutrient artery in the body. It enters the nutrient foramen of tibia below the soleal line. Circumflex fibular artery. It encircles the lateral side of the neck of the fibula. Communicating branch. It joins with a similar branch of peroneal artery, about 5 centimeters above the ankle. Medial malleolar branch. It passes towards the medial malleolus. Calcaneal branch. It pierces the flexor retinaculum and supplies soft tissues of the heel. Terminal branches. These are medial and lateral plantar arteries of the sole. Applied anatomy. Posterior tibial pulse. It can be felt against the calcaneum about 2 centimeters below and behind the medial malleolus and in the front of the medial border of the tendocalcaneus. Peroneal artery. Origin. It is the largest and most important branch of the posterior tibial artery. It provides blood supply to the posterior and lateral compartments of the leg. Course and relations. It arises 2.5 centimeters below the lower border of popliteus. It runs obliquely towards the fibula and then descends along the medial crest of the fibula in a fibrous canal between the tibialis posterior and flexor hallucis longus. Now it passes behind the inferior tibiofibula and ankle joints and ends on the lateral surface of the calcaneus and terminates by giving the lateral calcaneal arteries. Branches. Muscular branches to the posterior and lateral compartments of the leg. Nutrient artery to the fibula. Perforating branch. It is large and pierces the interosseous membrane about 5 centimeters above the ankle, appears in the anterior compartment of the leg, and terminates by anastomosing with the lateral malleolar branches of the anterior tibial and dorsalis pedis arteries. Lateral calcaneal artery. It is the terminal branch which takes part in the formation of lateral malleolar plexus. That's all. You now know the main arteries of the leg and their clinical importance. See you in the next video.